Hello, I'm Dr. Sridhar Reddy. So today we'll discuss about the diabetes, particularly type 2 diabetes, which we call it as diabetes mellitus. So generally, diabetes mellitus second type 2 diabetes is mainly because of the utilization of insulin is reduced by the body. So the utilization of insulin depends on the condition of the body. So when it utilizes and it automatically reduces the sugar in the blood so that it will be maintained. So in type 2 diabetes, mainly the insulin resistance will be there. So body cannot utilize the, even insulin is normal, but body cannot utilize it. So here generally people of all ages they are having, but particularly more than 40 years of people are having this type 2 diabetes commonly. And generally people are having always some confusion in the diet and everything. So particularly now the summer has already started, so mango season appeared. So everyone will have a taste for mangoes because whenever we see mangoes, we'll get desire to eat, we'll have the taste. So mangoes are already, it's known as king of fruits. So in India particularly, so mango is the best and mainly desirable fruit in total India. And particularly it comes only in the summer season. So because it's very sweetish and having juicy quantity, so diabetics are afraid of taking mangoes. So will it aggravate the diabetic sugar contents in the blood? So that's what everybody will have the doubt. So of course mangoes are having sugar contents in that, sweet natural sugar of course, and it aggravates slightly when it is taken in a not particular way. So generally whenever you want to take fruits, you have to take it in a empty stomach. So because we don't have anything, when already you have taken enough meals, then if you consume mangoes, like each 100 grams of mango contains 15 grams of carbohydrates. And in carbohydrates, 90% of this thing is sugar. So whenever you take mango after taking meals, it will aggravate the sugar levels, but not very much, depending on the quantity we take and depending on the digestion and the person's ability, everything. So generally whenever you want to take mango, it should not mix with diet, particularly meals. So it should be gap of some half an hour or 1 hour, or otherwise if you want to take along with meals also you can take, but the rice or whatever you take, that should be, the quantity should be lessened so that it will be balanced. So mangoes are very good in vitamins, protein also, and minerals. So many minerals are there, including carbohydrates and everything. So mangoes are very good for health also. So mangoes should be taken in summer particularly, and mainly in diabetes, not everyone. And you should add protein to that. Generally protein and fiber should be added with the mangoes so that it will become balanced. Particularly when you take mangoes, you have to add, you have to take it along with it. Boiled eggs or generally nuts which are having more protein. So then it will be balanced. And generally the natural products like fruits are very natural products, and even the sugar is also natural sugar. It's not artificial like our white sugar or sweets. So it can be taken daily also. Only thing is you have to monitor. Like generally we have to check when we are eating before eating mangoes, you have to check the sugar levels. Then after taking mangoes, we have to check the sugar levels so that how much it is increased. So sugar levels depending on how much quantity we take. If you take half mango and after half an hour or something, we check it again. So how much sugar is increased. So according to that you can monitor how much you can take and when you can take. So along with when you are taking, how much you have to reduce the other things like regularly you will be taking some fatty items or carbohydrates. So whenever you want to take mangoes, that should be somewhat reduced. And immediately after taking mangoes, you should not sleep. So when you are working or when the daytime, that's why generally we take mangoes in the morning or afternoon or evening, not in the night. So night time, when you take mango and go to sleep, automatically it won't digest and the sugar levels also will increase. So this is what we have to maintain. So every fruit, not only mangoes, even bananas also we can take, even pineapple, it's very sweetener, but it should be taken in empty stomach generally. So this is what we have to maintain. And generally people will eat mango or banana after they're taking their lunch. This is not advisable. And even if you are not diabetic also, generally it gives heaviness to your stomach, and so obesity also. So obesity also increases if you take mango or banana after your meals. So whenever you want to take along with meals, you have to reduce the rice quantity and then you can take. So this is what the sugar levels will be maintained. And second thing, in summer generally the alcohol drink, people who take alcohol and beer, who are generally take some in summer, chilled beer generally people are advised to take, and they desirable. So generally beer contains more of carbohydrates, everyone knows, and sugar also it will be there. And if someone takes regularly also, it increases the weight also. So obesity also, it automatically affects the diabetes. So it's the same like mangoes, beer also you should not take after lunch or something. So when any empty stomach also, it's very dangerous. Generally in the morning, some people will not take any breakfast or anything, directly they'll take lunch, and before taking lunch generally people take beer. So this is not advisable, because when the stomach is totally empty, beer will increase the heaviness and it produces fermentation, so that the bloatedness will come and it gives you very uneasiness, and even sugar levels will sometimes will go down. When you take in the empty stomach, sugar levels will go down. So hypoglycemic conditions will appear. So alcohol should not be taken in empty stomach. Anything, it may be beer or whiskey or something. So alcohol every time you should take only when something is there in your stomach, not in an empty stomach. So generally after taking your meals, if there is 1-2 hours gap, then only you have to take beer or something. And the same thing, beer also you have to, whenever you take beer, so before taking beer you have to check your sugar levels, and after taking beer, 1 bottle or something, 750 ml or something. So then how much the sugar is increased after taking beer. So this, if you monitor, then you can understand how much you can take or whether you can take or not. So it's nothing that you have to depend on some doctors or something. So you can check yourself, because everyone will not have the same effect. Some people can digest it easily, some people will not have any increase in sugar level, some people have mild increase, some people have very much increase. So depending on their reaction to that, you have to maintain. So before taking beer, you have to check once, and after taking beer, how much it is increased. So whether you have to reduce the quantity or you have to avoid something else. So like that. And of course it is depending on the mental condition also. Some people don't have any problem generally after taking mangoes or beer, but because they think much, they'll have tension, anxiety, because they think that by mistake I have taken beer, I should not take. So it may increase. So because of that stress, that mental stress, automatically some effect will be there and sugar levels will increase. So depending on the mental condition, emotional condition, activity. So generally diabetics, they have to do regular physical activity, particularly walking, brisk walk for half an hour daily. And then diet also, artificial sugar, they have to avoid sweets, they have to avoid maida, the bakery items, soft drinks, all these things they have to avoid. Sleep should be very perfect, and dinner should be at least 2 hours before you go to sleep. So all these things you have to maintain, and you have to reduce smoking, or you have to quit smoking. So all these things will be there, and once you are diagnosed with diabetes, people will have they think that it will be there throughout their life. But it's not like that. In our medicine, in our constitutional treatment, genetic constitutional treatment, our course will be there for diabetics. So depending on the condition, depending on the age, depending on the duration of the disease, it having a course of like 3 years to 5 years. If it is a recent one, and if it is not that much severe, it may cure in 2 years also. So depending on the condition, duration or everything, we will say that you should take 3 years course or 4 years course. If you take that course regularly, and the things which we tell to maintain, if you maintain that, it can be 100% curable within 3 to 5 years. And once it is cured, it will not come back again, only provided you have to maintain some diet, physical activity. Mentally you have to be confident, positive and happy. So these things, whatever we say you have to follow, then throughout your life you won't get the sugar back. So diabetes also 100% curable, and with our constitutional treatment. So whoever having diabetes, they should not be worried that it won't go completely, and even they can take anything, even mangoes, beer also in moderate. Only thing is to monitor the sugar, check the sugar level, so that they can enjoy summer, have a better summer. Thank you very much.